I'm Dr. Sreekanth Reddy. I'm a surgical oncologist practicing in Bangalore. I have a keen interest in spreading cancer awareness and educating my patients about cancer, its treatment, and how they are going to do further. So, as a part of that, I would like to do this video series to educate my patients. In this video, let's discuss about what is cancer. It's very important for patients to understand this. That helps them in making a treatment decision as well. Cancer is not a single disease, but a collection of related diseases which can affect any part of the body. At its basic, cancer is the disease of the genes. Genes are the software of our body cells, and they help in controlling the cell function, regulates the cell division, and once the cell has aged, it also controls the cell death. It gives commands to the cells so that the cell commits a suicide, which we call it as apoptosis in medical terms. So this is a common regulation which is done by the genes. Due to various factors, there can be defects in these genes, and when there are defects in these genes, the cells loses all these capacities. That is, it can lose the control of its function, it can have a loss of control over its cell division, and when the time comes for the cells to die, even that function can be lost. Because of this, the cells can get converted into a cancerous cells, and there will be uncontrolled division of these cells leading into cancer. Generally, our body has control mechanisms which can identify the mutations in these genes, and then it can cause the death of that particular cells. As we grow older, this control mechanism will be lost, and because of accumulation of various mutations in the genes, that is the reason why we see cancer mostly in old age people. When this mutation occurs, these cells can form a tumor. That is, because of the uncontrolled division of these cells, they can form a mass which we call as tumor. Tumors can be cancerous or benign. There is a difference between these things which you need to understand. Cancerous tumors or the cancerous masses are the ones which can encroach or invade into the adjacent structures without any boundaries, and they also have the capacity to spread to elsewhere in the body, which medically we call as metastasis. Whereas benign tumors, these are also lump forming tumors, but they don't have the capacity to breach the boundaries, and they don't spread to elsewhere in the body. Most of the cancers which you see are mass forming tumors which are called as solid tumors. There are also cancers which we call as liquid tumors, for example blood cancers. In blood cancers there won't be any mass formation, but the number of cells will be increasing in the blood. These are called as liquid tumors in a common language. What causes these genetic changes which can lead into cancers? These is the most commonest question which a patient generally asks in the OPD. They ask, why did I get a cancer? So if you see at the causes, 10% to 15% of the cases might be genetic, or we call it as familial or hereditary. That is because of having a defective gene which we could have got from our parents, or we might be the first one to have a defective gene in the family. Apart from genetic causes, because of various factors like environmental factors, for example getting overexposed to sunlight where ozone depletion is there, we can have defects, and we can get skin cancers. And for excessive usage of chemicals or toxins by smoking or consumption of alcohol, such things can cause damage to the DNA. And you also have viruses which can cause damages to the DNA, like HIV virus, HPV virus, or hepatitis B. These viruses also can cause damages which can cause cancers like cervical cancer and liver cancers. And also you have exposure to excessive radiation, that is ionizing radiation. For example, if you're working in a nuclear industry, or if you're an X-ray technician where you're more exposed to the radiation which is used in medical field, you have this can cause DNA damages, and such kind of damages also can lead to cancer. So these are some of the reasons where DNA can get damaged, and that damaged DNA can ultimately lead into cancer. So this is a brief about what is cancer and what can cause cancer. Thank you.